And really, this is an example of the DNA of Equally Well. But this is about a collective impact, and so one of the reasons of doing this is find out what people are doing across the country, find out the initiatives that have been well established and evaluated, find out about the initiatives that are just quite new and the ones that are being planned, and then put them in a searchable database so that when you're in your area and thinking, oh, I think I might do something on cervical cancer screening. Who else has done that, with older people? Who else has done that? So you can sort of click on the filters and go, there it is. There's somebody up in Queensland and someone else in WA. And there's the contact numbers, and then you can learn from them. And whatever that is, and for us, that's part of the collective impact, that you work together, you support one another through the challenges of implementation. There's always challenges of implementation, but also you can save yourself a year's worth of pain and trouble. Someone says, oh, I did this and it caused me so much trouble, blah, 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 blah. So just see that landmine, step around it, or do this or this. So you can, so we learn from one another. So what we're trying to do is make this a bit more systematic. We've tried to create this with a little bit of the communities of practice where people can share sort of informally about what they're doing. But this is actually making it so that anyone, anywhere, anytime can get into the searchable link of initiatives and go, I'm thinking about doing this, or I'm doing this. Who else is doing this across the country? Collective impact. And that's, you see the value in that? What we're trying to do is not another fragment. Equally Well is not another service provider. We're not a fragment in another already fragmented system. What we're trying to do is join up the bits so that we can work together better, given that how hard it is where we got GPs, which are subsidised from the Commonwealth, CMOs, NGOs, state services and private providers, all under different contracts, etc. And then we've got the different states and territories. So, such a fragmented system. So what we're trying to do is connect across those fragments. Have we got the slides up yet? This could be a verbal presentation only. And so what we did, here we go, great, and the clicker's working, awesome. So just very quickly, also part of this is collective impact. So part of the thing is we are the backbone organisation. Someone's got to do this work, the scan of initiatives, put it together on websites and ask people and chase them up 5 times and ask them to do it because everyone's got other jobs to do. So we're Equally Well is the backbone organisation, and what we're trying to do through this and other activities and our websites, and so please log on and newsletters, is to sort of communicate. Love to get your feedback about how to do that better. We're now thinking about communicating with a bit more purpose and say, just one thing, and there's some information that you need. Shared measurement, we're talking about that, common agenda, and mutually reinforcing activities. And that would be sort of the thing where you're working together. And it supports, this is great. I'm working with someone else who's focusing on cervical cancer screening in their units. And it's a wonderful thing to do, quite frankly. You might be someone in Brisbane and someone in Perth, and you're working together, and it's just lovely. It's reinforcing. But what we're trying to do, because it is pretty tricky, this is a fragmented system, and we're trying to like the V of the geese flying, to rise and get the lift from other people. And that's part of the method. But also, this is the clock, the fragments across different jurisdictions, different levels and different sizes. And it's, what it's like, it's a mess. So we're trying to work across this messy situation. And we're trying to do it across 3 levels, across the macro level. So we're trying to have a collective impact approach about what's happening in policy and the authorising environment. There's nothing like guidelines or a national agreement to go back to people and say, can we help you meet your obligations under that national agreement? Or can we help you meet your obligations under your state guidelines or the college guidelines? And so really collectively, and that's what we've managed to do with the cancer plan, is to say Equally Well as in the Australian Cancer Plan. So now we can go back to the different cancer organisations and say, can we help you about meeting your planning around the cancer plan? And that's what we want to do in sort of chronic care as well. So that's the macro where we try and work collectively. Also at the meso, which is the systems level. So working across the systems, and John Stevens up there is a great example of working across older persons' mental health systems, and there might even be a photo of you guys. There it is there, John, in the right-hand panel, of the older persons' services across New South Wales, doing something across all the older persons' mental health service systems in New South Wales, and they're partnering with universities and NGOs, etc., to do some of that system change in older persons' mental health and Equally Well. I suspect next year, John, you might be presenting on this, and the results of that statewide practice improvement project. But with LHDs within health and hospital services and LHNs across the different systems that exist. So we're trying to collect that data as well. And the other piece of data, of course, is the microsystems, stuff that people do, big or small, great or little. It's interesting. So, for example, I don't know if Jade is here from Flourish, but you know, the Fizzy Health cards, that person on the right there, you know, just sharing those. And I think in our very first conference, Jade presented and she shared them with someone from Flurio Health, Peninsula Health in Victoria, and it really transformed their practice. They introduced them, you know, and that's that microsystem of things changing within services. Things like the Nehemiah Health Prompt, the cards that Adrian's not here, but the College of Mental Health Nurses have, a little to put on your back of your tabard and your card, what do they call it, your lanyard card. So those sorts of, collecting that stuff as well. The Mudgee Health Clinic, fantastic innovation that's been going on, been through 3 practice managers, is a way of connecting mental health services with GP practices in a way that's just transformed the care, dropped unplanned admissions and just drastically reduced emergency department presentations by working the local mental health team together, working with the GP. No extra cost, just stuff that they've done. It's been going for about 12 years. I think there's 3 publications on it now in terms of the outcomes as well. But just, if you didn't know about that, this is what we're trying to get and to share, to say, you're thinking about joining your mental health service with a GP practice? Talk to the Mudgee guys. They'll love to talk to you about that, about what's working and what's not working. And also there with Flourish and Lived Experience Australia and Health Talk and those sorts of resources as well. So what we have is, just very quickly, this is the boring stuff, and I'm just trying to catch up a bit of time, Andrew. So these are the respondents. So we had 72 of our 100 supporters respond, which is not a bad response rate to a survey these days. Anyone who does research knows that that's an awesome response rate to a survey, 72%. And that's the sort of bulk of them. The PHNs were a lot because there's a lot of PHNs. And there were the different sort of professional organisations, education, primary health networks, peak bodies, etc. So we've just gone across all of our partners there. Having said that, with around about 100 supporters, there's a lot more organisations in the country than that. So this is what, just generally, just an overall snapshot, and then I'll jump onto the resource, which you can go online and have a look, and I'll put the website up in a sec. But this is the sort of stuff that people are doing. We managed to find, people reported 308 initiatives across the 72 supporters. And so once again, we didn't have all the supporters, but that's not such a surprise, really, and that's the sort of stuff that's happening out there and across Australia at the moment. I reckon we're a bit low when we look at this, and this is good for us as well. We look at this a bit low on oral health and vaccination and, quite frankly, smoking cessation. Smoking kills half the people, long-term smokers, and the smoking rate for people with serious mental illness is 6 times the general population. That's not right. So, we talk about equity and equality. I respect people's right to choose to smoke, but really it should be at the same level as the rest of the population. The rest of the population's gone like this. Big public health, Terry, success over the last 10, 20 years in terms of it's really plummeted in Australia. For people with mental illness, it's pretty well stayed the same. The 6 essential elements of the consensus statement, and once again, that's probably not that surprising, is it? That and this is how people if people described it that way. We've just taken them at their word. We're not, an assessment body. We're just really categorising that. But we're pretty encouraged by that. Monitoring progress was not service evaluation. It's that you're monitoring progress over a period of time. So it's not that we did this and we evaluated it. It's how we're going as a service or a nation. And so some of Grant's work is up there too. You can see how he's monitoring the progress and how we're going with the gap vaccinations, etc. This is a bit of a busy slide, and you'll have these slides available. But this is the percentage. And once again, things can be multiple things, of course. It can be psychological therapy, which is online. So you can see that adds up to more than 100%. So that's the percentage of supporters who reported that they're doing something in that area. And a lot of organisations, as you know, like yours, are doing more than one activity, of course. 72 organisations, 308 activities. So they're the sorts of things that people are doing, and which is good. The software is 12%, the online stuff, that's not bad. I think people said that that's an area where we could do a lot more in terms of access, easy access, SMSing and stuff like that. The physical health conditions that are being focused on, and once again, not surprising, there's a lot that are focusing generally in health and well-being, but there's others that are focusing on, cancer and dental and oral health, respiratory disease and diabetes. I really think diabetes is an area that we could do a lot better in myself as well. There's a whole networks are there. The risk, the number of people who die from diabetes with serious mental illness is about the same number of people with mental illness who die with suicide each year. We don't talk about that, do we? But we have a zero suicide prevention, millions of dollars towards it. How much is towards preventing early premature death of people with diabetes with mental illness? And we've got a system out there. We've got all the diabetes nurses and all that sort of stuff. Such an easy win if we just can once again, integrate into general practice for chronic conditions. That's the population cohort. Based on today, in terms of some of the intersectionality, we've got a bit of work to do there, but it's not bad, Maybe I'm a delusional optimist, but I think that's not bad. The LGBTQIA+, cold communities, rural and remote, all about 20%. Maybe we could do better, but I think that's encouraging, really. Child and youth, that's to be expected because premature death doesn't really come in until, late teenage and early adulthood. The staff and professionals involved in the project, they're the sorts of people who are involved. Once again, I don't think there are any big surprises. I'm going to shoot through now and quickly through. The only other thing which is, we're evolving. I think we're evolving so quickly and growing and maturing mental health so quickly. I'm so encouraged by this, like the peer workforce across Australia, for example, and the involvement of lived experience experts in advocacy and governance now. And also in this is an indicator, once again, a self-reported, as Chris mentioned yesterday, what's true co-design, it's evolving, even that's evolving, isn't it, Tessa? But 78% saying that they're incorporating lived experience views into design and implementation. That wouldn't have been the case 20 years ago. It would have been the other way around, I reckon. So we've got a long way to go, but we're doing okay. We're progressing. So if you go to the website, under Equally website, National Scan of Initiatives, etc., it's still under development. We've still got 308 initiatives. I think we've got about 80 odd in there so far. So we're just now tagging them all so that you can search them. But you can have a bit of a go and you can muck around and start to do those search filters. And so for this, like the program focus, the health focus, and the population cohort. And so this is one example that I got from a screenshot. And so when you put those in at the moment, this is some of the things that you get. And you notice up here, you'll get a link to the website. You'll have a phone number and an email. So if this is something you're interested in, you go, oh yeah, while you're white GP connection, I'm going to talk to the folk at Assessment, Central Eastern Sydney PHN about what they're doing in that area. And that just was an example. There's the link. I'm just conscious of the time. So I was going to take you through and demonstrate how it works, but you can do that yourself. If it doesn't work, let us know. We're right here. But we've tried to make it really user-friendly, and you can filter by one and the other. And that would be us. And there's the other thing. The next steps for us is to continue to seek content. We continue to update that from other sources. We've only got it from 72 organisations across Australia. How many mental health organisations are there? And also other sources. Even from here, surprise, surprise, we'll be reaching out to the good projects and saying, can we get this up onto our website as a resource? Other partners, with the LHDs, LHNs, Lisa would be familiar. There's a report from South Australia. But there's lots of stuff happening in the local health networks that we still have to unpack. Same in New South Wales. We've got a New South Wales report, but we haven't gone to each of the 15 LHDs to find out what they're doing there. So getting the deeper dive into what's actually happening locally across the different states. And at any work in development as well. One other thing, we're doing the research scan. In your folders, there's a QR code. If you're involved in research at all, if you could fill in that research scan, because we want to do the same thing with that. So if you're interested in research and evaluating or can getting a research team together about physical health, you can identify the people who work in certain different areas. We need people to fill in that information and only give you details out with your permission, prior permission. And finally, to tag and curate the resource repository. We have a repository of all sorts of carer consumer resources that you can give clinicians or carers or can give, or consumers can access themselves. We're going to start to tag those as well, so you can search for them as well. So worried about smoking, worried about weight, worried about cancers or cervical cancer or breast cancer, the resources for that. And this afternoon, a bit of an ad, Tessa's coordinating a thing to how to, design a consumer resource which is consumer-led. So we don't want that looking like, but this afternoon after the conference, anyone who's interested in participating in that, Tessa, wave your arm. Tessa's wonderful, so you can participate in that. So we want to tag those consumer resources as well. And that's it for me, Andrew.
Thank you, Russell. Round of applause for Russell.